This is Andrew Cohen. I'm a board certified plastic surgeon here in Encino, California.
How long does augmentation surgery take, and how long are you under anesthesia for?
It's usually about an hour. There are some surgeons that can do it in 15 or 20 minutes, and it looks like they did it in 15 or 20 minutes. But most of the skilled board certified plastic surgeons take about an hour to do it to make sure it's done correctly and you don't need any other complications afterwards. So it's about an hour of surgery if someone's taking their time and being precise. And then about 45 minutes of recovery time in the recovery room. But then, the initial healing of a breast dog is 5 to 7 days, but it can take a little longer for the scars to heal. And it's done under general anesthesia.
There's a lot of chatter on the internet about techniques above the muscle, below the muscle, dual plane. Can you tell us what they all are and how each one is used and in what circumstances?
That's a lot, but I will. Dual plane just means you're under the muscle, and there's different types of dual plane, but that's pretty much what the majority of us do. It's a dual plane where we release the muscle and it goes under the muscle. It's dual, meaning part of it isn't covered by the muscle. Subglandular is above the muscle. I rarely do that. Usually in bodybuilders, I've done that, or if I have to do a revision and there's too much of a distortion when they squeeze or hug their partners or lift something. If the implant is being distorted from the muscle, sometimes you can just put it above the muscle and that takes care of it. So, pocket position is extremely important. It's usually under the muscle in my hands because I find that under the muscle makes that implant less palpable and gives me a nice soft breast implant.
How long does it take to recover from a typical breast augmentation surgery?
In my hands, about 5 to 7 days. You hear of people doing fast recovery or flash recovery. It's all, a lot of my patients can go out to dinner that first night or second night, but we prefer you to just kind of chill and not do too much because you can bleed after surgery. So yeah, we do a lot of flash recovery and fast recovery, whatever kind of social media term you want to see. I do a special block of the breast tissue so you're not hurting. So most people are just a little sore. We give you a muscle relaxant and a pain pill so that you're not hurting. But we don't want people going out to dinner that first night or doing anything too crazy because you're going to bleed. So you don't want to do that.
What about lifting things or going to the gym?
6 to 8 weeks before going to the gym or lifting anything more than 20 pounds, or more than 10 pounds, I should really say.
But when can you go for a walk then?
Right away, you can go for a walk the next day. Just don't go 5 miles. You can go half a mile the next day and then go a little further, a mile after a couple days. It just depends. We don't want you doing too much or elevating up your blood pressure because it'll cause bleeding.
Do you ever see people push themselves too soon?
Yes, all the time. This is LA, man. Yeah, they're pushing themselves all the time too soon.
When do they get to see their results for the first time?
The next day. We have you look at it the next day. We take everything off, you look in the mirror, and it looks great. But there'll be some bruising, but we let people look at it right away. We like people to see what's going on.
Do the implants change or change position or fall over the next few weeks or months?
Yeah, they have to kind of fall. They're going to be a little bit high and a little swollen, and then they fall and come into place after about 3 to 4 weeks for the most part. Some people take longer, but usually 3 or 4 weeks.
What is the first thing that patients say when they see the final results? Do you get their feedback at that point?
Oh, of course. Yeah, people are always very, very happy. They like what they see. And, it's a very satisfying procedure because they're really changing people's lives.
Tell us your Instagram and your website address.
My Instagram is really easy. It's Andrew Cohen MD, and my website's also Andrew Cohen MD. So we keep it simple.
I love it. Thank you, Dr. Cohen.
You got it. Thank you.
Links to our guest's website and contact info are in your show notes. Follow us on Instagram at Where Before Meets After. If you're a board-certified plastic surgeon and would like to be a guest or a sponsor of the show, go to wherebeforemeetsafter.com for more information. Where Before Meets After is a production of The Axis, the podcast agency for aesthetics. THEAXIS.io.